procedure that allows a luxating patella or a kneecap that pops out of a joint. One of the common reasons that occurs in small dogs is having a very shallow groove. Or if you use the analogy of a pulley system, your quadriceps is kind of the rope that pulls the pulley, your kneecap and your knee are sort of the pulley system itself, and they lift the lower leg up. Well, some dogs have a real shallow pulley. We call it the trochlear groove, and that groove is shallow to where the kneecap jumps out of the pulley. And as we know from a pulley system, if you're standing underneath it, you can pull things up on a pulley system and gives you good leverage. But if you stand at an angle, it jumps off the pulley. Same thing with the knee. If the groove is real shallow, the kneecap jumps off the pulley system, and it becomes a problem in dogs. And the most common thing that we see in small dogs is medial to the inside, the kneecap jumping to the inside of the leg, or lateral patellar luxation. We most commonly see medial patellar luxation. So what I'm doing today is I'm actually deepening the knee groove where the kneecap travels in. So I'm deepening the pulley system. Very common problem that we see in small dogs, probably one of the more common orthopedic issues that we see in poodles and Malteses and Havanese and all those little dogs. So today, what I've actually done is here's the kneecap, here's the grip of the knee. The kneecap is over here, all right, and there's a little tendon that it goes to. There's the kneecap, there's the tendon, that's where it attaches to, and this is the groove that normally attaches in. And what I've done is I've actually deepened that groove and taken out a section of the kneecap, which is here. You see a little kneecap, that's the little groove, and there's the bone underneath it. And what I'm going to do is I'm going to save that. That's why I put it over here in a special spot so it doesn't get thrown away or accidentally fall off the table. We put it over here in a special spot. And then what I'll do is I've actually deepened, I'll turn the suction back on. I've actually deepened this groove here. I'm going to deepen it. I've made a mark. You can see the mark here. And I'm going to take about 2 or 3 millimeters out of this. And then I'll put that kneecap back in. And what that'll do is it will allow the kneecap to track back in and not pop out of the joint. Now sometimes, so now you can see, watch here. So here's the kneecap, watch. Point, there it is. The kneecap's right here. This is where it attaches to the patellar ligament or tendon. And this is where it's attached to. It's called the tibial crest. Sometimes, because this has been out so long, sometimes this tibial crest will be sitting over here as well. And the reason the body does that, again, it wants to form a straight line from the hip to the knee to the ankle. And if the kneecap is out here and this tibial crest is right here, it's going to want to jump back and forth. But the body wants it to function appropriately, so it'll actually grow to where this is actually sitting here. So sometimes I actually have to move this from in here to out here to move the pulley system so it's a straight line. Today I don't have to do that because it's nice and lined up with the ankle, toes, ankle, kneecap, hip, everything's lined up. So once that kneecap is in, it shouldn't pop out anymore once I deepen that groove. And hopefully the dog will do better. Now other things that we do see sometimes with this kneecap popping out is one of the things that your cruciate or ACL ligament does is it prevents excessive internal rotation. And when the kneecap is popping to the inside, it causes the knee to rotate internally, and it can put excessive strain on the ACL, and you can have an ACL injury too as a consequence of this chronic problem. Very common thing that we see, very common surgery that we do. Highly recommend if your dog, a small dog that's kind of walking down the road, it skips occasionally, doesn't use its back leg, to have it evaluated by your veterinarian, and then considering surgery if the dog has more issues, more bad days than good days.